7 o'clock-ish. Okay, right, maybe 7:18, but it's that there or thereabouts. It's in the 7 o'clock area. It's in the environ of 7 o'clock. Some would say it's 18 minutes past. And who am I to question that? But anyway, it's what it is. It's here, it's now. Eye is ear. Jonathan Staiano, plastic surgeon to the stars. I have got a list of questions which have been asked. If you have any questions, then feel free to ask it live here and now. I'm very happy to field questions on the area of the plastic surgery. I'll be very happy to have a bash at helping out if you've got a question or a query about anything. If you don't mind, I'm going to kick off with question one. So question one is this. I have on the sides of my boobs funny bits of loose skin that hangs over the side of the bra. Is this because of my brachioplasty compression or just more empty skin? Will this be fixed with a breast uplift, or will it be really be there after I stop wearing compression? Right. Oh my lord, my plastic bands have come off. So I think I know what you're talking about. The first thing I would say is if something has come up after wearing a compression garment for a brachioplasty, the first thing is like wait until you stop wearing your compression garment and see how it goes. Because if it's just come up after wearing a compression garment for your brachioplasty, then it might go just as quickly as it's come. So that's the answer specifically in terms of the brachioplasty compression. But to widen it up to say, I think I know what you're talking about with this skin, the skin that goes over your bra, the lateral to the breast. That's not uncommon for people to have that bit of skin in the overhang, and that's something that people often talk about and ask about. And there's a couple of issues with it. The number one issue is probably the easiest way to deal with it, if it's not much, is with liposuction. So liposuction can help to get rid of some of that fullness that goes over the bra strap. Now, it's important to have a look at how it looks without a bra on, because when you have a bra on, especially if the bra is tight, then that causes a bulge. That's normal. And so when we're doing surgery, obviously you're not going to have a bra on, and we want to make it look good when you don't have a bra on. So if it looks okay when you don't have a bra on, then I would question whether you should be having anything done to it at all. Because if it only appears when you put that bra on, we don't want you to look good when you've got a bra on, so you don't have the bulge, because then when you take the bra off, you'll have a dent. Does that make sense? So if you haven't got a bulge at rest, if it looks normal at rest and the bulge only appears when you've got a bra on, it might be the band of your bra is a bit tight. You know, do you need a wider band? Or to be honest with you, everyone's got a bit, you know, it's like a belt. You know, when you've got a belt, you've got a bit of an overhang over the belt, especially if the belt's tight, it gives you more of an overhang. But if you start liposucking it so you don't have an overhang, then when you take the belt off, you'll have a dent. So that's the number one point I'm going to make. There was other points I was going to make, which were, oh yes, specifically, will it get rid of it with a breast lift? No. Perhaps I should have answered that bit first. No, a breast lift will not address that side bit here, the side bit. So a breast lift, you got to think what you can get to when you're doing the surgery. You can only get to the front, you know, the breast, the bit on the front. You can't get to the side. You can't get to that lateral chest wall. So you as I say, you can combine a breast lift with liposuction, but you can't directly access that bit when you're having a breast lift. So that won't be helped. If it's bad, if there's a lot of skin there, now that's really a massive weight loss patient who have a lot of skin there, you can then also do excisional surgery, so cutting it out, which can be combined with a breast lift, can be combined with an arm lift, just extending the scar across to tighten that skin, to cut that skin out. But it gives more scarring and all the issues with taking scarring and complications of wound healing, etc. So it's not common to need that bit addressed. It's certainly not common to need to have it excised, except someone who's had a massive weight loss. Probably the most common thing is a bit of liposuction just to help empty out that fullness. But as I say, it's got to be there when you take your bra off. If it's not there when you take your bra off, I'd be saying, look, you know what, maybe the bra's a bit tight, or maybe it's just what it is, and you've got, you're gonna have a bit of overhang there when you put a bra on, because if you've got to contour it and make you look good at rest without a bra on. The chat is going crazy. It's gone mental since I've been talking. Roxana says hello. Khan says hello. Everyone's saying hello. Amanda, glad I made it this week. If I had my BA surgery in April, do you think I'll be okay to go on holiday middle of June? April, May, June. Oh, God, that's 6 weeks, Amanda. Surgery in April. That's assuming you have it at the beginning of April. I think that's pushing it, Amanda. I think you might be okay. But I think that's pushing it. I think 6 weeks is going to be, that's going to be minimum of 6 weeks, could be less than 6 weeks. What I normally think of is, this sort of surgery is quite big surgery and it's quite a major life event. So ideally, you'd want to give yourself a bit more time to recover, ideally. Now, you might be fine at 6 weeks. You're probably still going to be a bit uncomfortable. You're probably still going to be a bit swollen. The shape's probably not going to be quite there. The scars are going to be a bit red. So if you are going on holiday and you've got to carry bags and things, it's going to be uncomfortable. So I would say just give yourself a bit more time. If you push it and say, look, my life is so busy, I have to have it that time. And, I've got to have it that time. 6 weeks is probably about the minimum you would want to wait before doing that sort of thing. But there is no maximum. So ideally, a couple of months, if 2 or 3 months, just to let it all settle down a bit more and let it settle a bit better. So I would probably wait a bit longer if you can, Amanda, would be what I would be thinking if I was you. Either have it done after your holiday in June, or maybe have it done earlier than April if you can. That's my view. So yeah. Thank you, Amanda, for a live question. Loving the live questions, but I'm also loving the preordained questions. Equal love for both types of questions. I am very grateful for any interaction, and cool. Thank you, Amanda. Thank you for asking the question. So, do you use staples with a thigh lift? I'm not sure if this is the sort of singular you, i.e., me, or the one. Does sort of do people. So, singular you, me. Am I making any sense here? No, I don't. Personally, I don't use staples with a thigh lift, but staples can be used for a thigh lift. So personally, I don't use staples for skin closure for any surgery. The only I might use, well, not really, not any surgery that I do these days. To be honest, I use obviously for big skin, not obviously, but big skin grafts and things. You might use staples, but for and you might use them temporarily for something. But personally, I don't really use staples for any type of skin closure. That doesn't mean they're wrong or they're bad. Some people do use staples. Not many plastic surgeons would do skin closure with the staples, I don't think. The reason being that they're not very nice. They're difficult to take out. They're quick to put in. So they are. There is a good thing about them. They are quick to put in, and they do make the surgery quicker, especially for big wounds like thigh lifts. Well, also tummy tucks, and lots of big wounds. I remember I used to work with a surgeon who did them for breast reductions, use staples. So it is a thing. It's not like outside the realms of sane practice. I think it's perfectly reasonable to use them, but I think they're a little bit uncomfortable to take out. It's a little bit, I don't know. I think most people would use a subcuticular stitch where we go underneath the skin, so you can't actually see any of the stitch. So the stitch holds the wound longer. With staples, if you're using staples in the skin, you've got to think when you're taking them out, because you don't want to leave them in so long they're going to give stitch marks, but you don't want to take them out too quickly so the wound opens up. So that is a problem with using staples for something like a thigh lift. though you probably put deeper stitches in as well. But I think most people would use a dissolvable suture underneath the skin, which will hold it together for longer. But it's a reasonable thing to do, I guess, but not common practice. And if I always say, don't worry I've got to think of a good strap line around this so I can say it really nicely, but I'll have to go and think about that. But basically the point is, don't worry so much about the technique or the technicalities of what you're having done. Worry about your surgeon. If you've got a good surgeon who's got good results, happy patient, seems like a nice person that will look after you, and they use staples for a thigh lift, that's okay, I guess. If they've got results they can show you of thigh lifts and the scars look good and patients are happy, I wouldn't make that a deal breaker. I think you've got to worry more about the surgeon than the nuances of the technique. I think it is good to ask questions about the nuances of the technique, and I thoroughly encourage it to the extent that I do this every week. So obviously I do encourage it. So I think it is important to ask questions, but at the same time, I think it's important not to tie up too much into the response, because I don't think that's going to give you a good result or a bad result, having staples or having some kind of, I don't know, some kind of stitch or some kind of technique is not necessarily going to be the good result and the bad result. It's the surgeon that's probably going to be the most important determinant of the quality of result. After TT, tummy tuck, that is, folks, I'm sure you all know that. Why is my tummy really itchy, but I can't decide where the itch is? So that is very common after surgery in general. And as things start to knit together, it is itchy. So an itch is a sign of healing, a sign of things knitting together. So it's quite common, certainly the first few months after a tummy tuck. Big operation like a tummy tuck is often quite itchy. And what I would say to people is, don't scratch, don't use the nails, sort of rub, and ideally sort of massage, get a bit of moisturizer cream and massage. Try not to scratch because you don't want to excoriate the skin and cause problems with the damaging the skin. So try and rub rather than scratching, but it's just a sign of healing. It's not necessarily a bad thing at all. It's absolutely fine. Rub rather than scratch. Can hypermobility affect my TT result? Can hypermobility affect my TT, i.e. having extra stretchy skin? Yeah, I mean, I think so if you have got sort of diagnosed hypermobility as sort of some kind of collagen disorder, Ehlers-Danlos syndrome, or some disorder of your skin that means you've got hypermobility, then that might mean that you will potentially have more problems in terms of wound healing. So it might have an effect on your healing. So that is something that would have to be taken into account when you're deciding whether or not to have surgery. And if you were being looked after by a physician for your hypermobility, it would probably be reasonable to talk to your physician about whether anything you could do or we could do to improve the result. But that's the main thing I'd be worried about, is wound healing with the hypermobility. But if you have, I'm assuming you require a tummy tuck because something has happened, like you've had children or you've lost weight, so you've got excess abdominal skin. And so, yeah, I think you can have one fine, but you might be at an increased risk. But it'd be really looking at what exactly your problem is, and if you have got a problem with the collagen with the skin, there may be an issue with healing. You may have a problem with healing as part of the same um, disease, if you like. If it's a disease of your collagen, which is part of your skin, gives your skin the elasticity, then that might have an effect on the ability of your skin, your body, to heal. Bidet, what's happening? Oh, God, what's happening to the chat? Nothing's happening to the chat. Chitty chat. Amanda, cool. Thank you for that. Yeah. Well, we don't need the chat because we got a question right here, people, and this question needs answering. Okay, because this is if one person's asked this question, I'm sure there's 100 people out there with the same question. When can I have a tattoo on my TT scar? Good question. So And in my experience, the thing that I say differs from the thing that the tattoo people say. Because I normally say you can tattoo it sooner than the tattoo people. I say, oh, hey, can I get a tattoo? And then they say, oh, I've been to the tattoo person. They said they wouldn't touch it for a year or something. But I would say, I'm going to say 3 months. I'm going to go out there and say 3 months is when I would say you can have a tattoo on your scar. Now it will be a bit a bit red, a bit overly coloured, hyperpigmented. Your scar will. So your scar will not be fully faded at 3 months. And it probably will take about a year for it to fade, the scar. So I don't think it's unreasonable to wait a year. But if you wanted to, and I don't see there's any problem with having it tattooed before then, personally. But as I say, often people go to the tattoo people and they say, "Oh, I'm not touching it." So you better do what the tattoo person says. They might say it's up to the doctor. I doubt it, but if they do, um, about 3 months would be the earliest, but you might want to wait a bit longer for your scar to fade, because it will, after at a year, it'll be a lot more faded than it is now, assuming it's less than a year now. So you might find that it fades to the degree you don't want it tattooed. If you're getting it tattooed because you feel the scar's obvious, wait at least a year, because it might fade and you don't actually want a tattoo because it's faded so well. Chat has kicked off. Anna and Kerry. Anna, what's going on? Anna's had 2 areas on my hips that are not healing and more painful than the days post-op. I now have a stoma dressing on one and the other feels like it's about to burst open and is very hot. What would you recommend? I would recommend you work closely with your surgeon, Anna. That sounds bad. Sorry, when and more painful than the day. So Anna, that's Kerry. So Anna, when was your surgery? How long ago was it? Does she say that? No, she doesn't. So basically, I'm assuming it's a tummy tuck. Is that a fair assumption? 2 areas on my hips. You often get problems, and you can often have it all healed fine, and then you can get problems with bits that get painful and certainly can start discharging and things with the dissolvable sutures. So the dissolvable sutures can often cause little inflammatory areas, little spots that don't heal and can spit out suture and cause problems. It sounds like you got more than that, Anna, because you've got a stoma bag on. So a stoma bag is a bit more than an infected suture. A stoma bag suggests that you got a bit of fluid, probably got a bit of fluid inside in terms of a seroma, which is very common to have a bit of fluid inside, but often you don't notice it, because it's inside. When you have a little bit of a wound breakdown, then it starts to come out, and it can be a real problem. But basically, I'd work closely with your surgeon. But when this sort of thing happens, normally and often the hole, if you like, or the place where the stuff is coming out isn't too bad, and you think, why is this stuff coming out? So the stuff is coming out not because of the hole, but because it's there. And really, that hole won't heal until the stuff stops coming out. So while there's still a flow, the hole won't heal. So it's just a question of waiting for that to, in a way, I guess it's good that it's coming out. I don't know what's coming out. I'm kind of hoping that it's sort of clear, like straw colored fluid coming out, sort of. She's saying it's burst open and it's very hot. The one worry is it infected? Because just because you've got a stoma bag on and a discharging wound doesn't necessarily mean it's infected. But if it's hot, if it's tender, certainly if the skin's red, and certainly if the stuff coming out is not clear, it's usually yellowy clear color, so you can see through it like sort of lager. But if it's thick, if it's yellowy thick like custard, then that would be more likely to suggest it's infected. So therefore, you might need antibiotics. You might even need it washed out and having theatre and things like that. So, and also it depends on how you feel. If you're feeling well in yourself, obviously you're not feeling great because you've got a bag on on your wound. That's not great. But if you feel well rather than feeling ill, then that's a good sign. So so the 2 things I would say is, first of all, is it infected? Because if it's infected, then something needs to happen. Not first of all, probably antibiotics. Take a swab of the things. This is for your doctor to sort out, but they'd probably take a swab of the stuff coming out, or send a sample of it to microbiology. Start you on antibiotics, potentially take you to theatre if you're becoming ill with it and it's getting very red and angry. But if it's not red and angry, if you're not feeling ill with it, and it's just a nuisance, then it's just a question of waiting for that discharge to stop. And once that discharge stops, the wound will heal. But it will be very frustrating. It is often frustrating because having a little tiny wound and it just continues, it discharges. But it's as I say, it's not the wound's fault. It's the stuff inside that's the problem. Oh God, Anna's. Oh God, here we go. She's so just coming up to 4 weeks. Okay, that's early days. Tummy tuck, muscle repair, and lipo on flanks. Okay, watery yellow fluids. That sounds okay. Um, Olivia's here, but I'm here, but I'm not. Oh, hi Olivia. Olivia's here, but not. So yeah, Anna, that sounds like it's just seroma fluid, the clear watery yellow fluid. And really, so it depends on if you're feeling sort of okay. At 4 weeks, it's still early days. So yeah, just stick closely with your surgeon is the main thing. Stick with your surgeon. Stick with the dressing. You know, if you're getting nurse or whatever to help you out, because they need to keep an eye on it. Make sure it doesn't get infected. You know, and things like that. So keep an eye on you. But it's hopefully it'll be okay, Anna. Hopefully it'll be okay. Be strong. Stay positive. Eat well. Fresh fruit and veg. Good diet. You need to get this wound healed. Eat well. Try and stay positive. Really hard, I know, when you've had a cosmetic operation and you're left with a stoma bag on and you think, flipping out, this isn't what I signed up for. I know it's hard, but I'm sure it'll be fine. I'm sure it will be fine. Kerry, I had surgery in May. It's become apparent I have a fair bit of excess skin still. Briefly touched on a revision with PS. Plastic surgeon, that is, people. Getting to know my abbreviations. But I have had 3 seromas. Would this cause the excess skin? I've gained 4 pounds since surgery, but I can't see that would cause such excess skin and bulge above my BB. BB? Oh, belly button. Right. Abbreviations coming out of our ears here. Right. So the first thing, if there's a bulge above your BB, that might have been pre-existing. So that might, you know, we do our best to make it as tight as we can, but it's hard to get a direct pull on the tissue above the belly button. So sometimes there is a risk that you could have some fullness in the belly button, above the belly button. Pre-op, you know, you could have had a fullness in your upper abdomen pre-op, which would have been better by the tummy tuck, but maybe didn't directly address that fullness sort of underneath your rib cage. So that is a thing. 3 seromas will not help. What depends what you mean by 3 seromas. It depends if you've had a lot of fluid and your tummy really swelled a lot. That's going to stretch the skin, but hopefully not to the degree that you need a revision. You know, it's usually not that bad. 4 pounds isn't huge, but you've got to be careful with your weight. You know, you don't want to make your weight fluctuate too much because it can have an adverse effect on the result. These things can all stretch the skin. But I think if the skin, but usually weight, seroma, all these things would stretch the skin in the lower abdomen. The lower abdominal skin stretches before the upper abdominal skin. So if you've got excess skin and bulge above your belly button, I'm thinking that is probably something that was pre-existing, or at least because, you know, we or whoever, the doctor, couldn't get it pulled down and get it as tight as they might have liked. And that is something that you can have liposuction on to help with that. That does respond quite well to liposuction. We don't normally do liposuction to that area at the time of the tummy tuck. We usually wait for everything to heal and then we can do a bit of liposuction later on. But does it say how far after surgery? You probably want to wait a good few months, you know, 6 months or so before thinking about that. But I doubt it's the seroma or the weight, to be honest with you. If it's above your belly button, it's probably just a bit of laxity in the skin that they tried to pull down and make as tight as they could, but couldn't quite get that as tight as maybe they would have liked. Here we go. Olivia's in. So Olivia is here. I do have a question, JJ. 5 weeks post-op, I just had to lift a smallish 99. What? The smallish 99-year-old out of a car. I just had to lift a smallish 99-year-old out of a car. Okay. My armpit is now aching. Will I have hurt myself? Oh my God. Blimey, alrighty. I didn't know. Right. Okay. I think you need a fireman. You need a fireman for these sorts of questions, Olivia. I'm not sure if I'm suitably qualified to answer this question. Will I have hurt myself? Well, have you hurt yourself, Olivia? I mean, I guess that's the question. Have you hurt yourself? If you've hurt yourself, then yes, you will have hurt yourself. But if you haven't, then no. I mean, five. You know what? It's difficult, isn't it? I mean, we normally say if you're having surgery, don't take things easy, stuff like that for 6 weeks. Don't. But sometimes stuff happens. You've got a 99-year-old. I don't know if that's a typo. You mean a 9-year-old? Anyway, whatever. 99, maybe it is a 99-year-old. If you've got a 99-year-old, you've got to help them. And so you've got to do stuff. And that might make things hurt and it might make things swell and it might make things uncomfortable when you do that and think, crikey, I shouldn't have done that. I'm going to take it easy. But it's fine. Don't worry about it. If just take it easy from now, Olivia. And I think you'll be fine. If everything looks okay, you might have a bit of an ache. Well, you have got a bit of ache, so just take it easy now. I'm sure you'll be absolutely fine, Olivia, and I'm sure you haven't done any lasting damage. So, Olivia says hi. Hi, Olivia. Nice to see nice to see you. Okay, on the hypermobility question. Loving it. Hypermobility question. I have this, and I have had 2 breast surgeries and an emergency C-section, hip to hip, and healing time was not an issue. My scars were almost visible. There you go. Right. Kay's had it, and she was fine. Kay's got hypermobility, and she's had multiple surgeries, and she was absolutely fine. So there you go. So it's not a fait accompli that you can have a wound healing problem. You might be fine, just like Kay was, and the scars are invisible. So yeah, I think I think that hypermobility doesn't cause worse scars or anything. I don't think it's associated with scars. It's more the healing rather than the scarring. But case in point was fine. It's always difficult because you can find people. That's one of the problems with the internet. Really, you get individual people giving experience, which is very, very useful. But sometimes people say, "Oh, I had this and it was terrible." I had teardrop implants and it's rubbish. They're rubbish teardrop implants. They're awful. Or I had whatever, and it was awful just because that was. So just because it was, that doesn't mean that all teardrop implants are awful just because one person had a bad experience with the teardrop implants. But it is useful. So I think, and I think what I would do, Kay, is I would probably talk to the physician who. So you've obviously had no problems. If someone came with hypermobility, I would probably talk to their physician or ask the patient to talk to their physician and say, look, is there going to be an issue with this? Because there might be a situation with people who've got hypermobility with no problems with healing, and they might say, look, don't be ridiculous, you'll be fine. And you clearly were, which is great. So that's good. Thanks, Kay. Thanks for commenting. So Amanda, I know from previous chats you said you do not use drains in BA surgery. I've heard conflicting info on this. Are they not necessary? What happens to fluid when there's no drains? Good question. Goes back, Amanda, to what I was saying earlier about choose your surgeon rather than the technique. People do worry about the technique. And the thing about drains, there's good and bad about them. Anyone tries to tell you it's better to not use drains or it's better to use drains is like, there's no right or wrong because some people do use drains. And that doesn't mean they're wrong. And some people don't use drains, and that doesn't mean they're wrong. And broadly speaking, the thing about drains, absolutely right. There is fluid there, and the drains will take the fluid out. So that's a good thing about drains. Bad thing about drains, couple of things. First of all, they're uncomfortable. Patients don't like them. So number one, patients don't like them. So if you can avoid using drains, patients will thank you for that because patients don't like having drains. Number two, when you are having a drain, particularly with an implant, you have got a potential portal from the outside world into the implant, a potential sort of what's the word, pathway to the implant. So that's something you've got to think about in terms of infection. But normally the drains aren't in for too long. So that's not but that's a thing. You've got to be aware that there's a bit of plastic that goes from the outside world into your implant. So that's something you've got to think about infection. One of the big reasons for using drains is for hematoma. So yes, there's a bit of fluid. There's always a bit of fluid. And to be honest, even when you take the drain out, there'll probably be a bit of fluid produced around the implant, which will then get resorbed. And one of the big indications or the reasons we used to use drains is for hematoma. And they've done studies on breast reduction, which is much more cutting than a breast augmentation. and they put drains in one side and not the other side. And what they found is basically you can get a hematoma whether or not you use drains. Because the problem is if you don't use drains and someone gets a hematoma is blood collecting inside and it all balloons up. You have to go back to theatre and have it washed out. So if you get a hematoma, you'll probably think, flipping it, if they'd used a drain, I would have been okay. But now we've got studies which say, actually, no, if you're going to have something that bleeds enough to cause a hematoma, a drain isn't going to stop it. A drain, might come out, the blood might come out through the drain, but it's not going to stop the bleeding. You're going to have to go back to theatre anyway and have that bleeding stopped. So the main reason I stopped is because they have been shown not to stop hematoma. And so for breast augmentation and for breast reduction, I've actually pretty much stopped using drains. For a big breast reduction, I will still use them. So that's why I've stopped. But I do still use them for tummy tuck because there's more of a dead space in tummy tuck. There's more space in tummy tuck, and the suction of the drain sucks the two walls down. But I'm starting to use quilting sutures now and things, and well, I've been using quilting sutures for a while, trying to do other things rather than using a drain, because to be honest with you, if I could get away without using drains for anything, I would, because basically patients don't like them. But as I say, you'll find surgeons who do use drains for breast augmentation. Doesn't mean they're wrong. It's not uncommon for, we used to use them. We all used to use them, but I think the trend is away from drains, really. But yeah, good and bad about both. Amanda, choose your surgeon. Don't worry too much about. Don't make drains a deal breaker. I wouldn't. I'd choose a surgeon. Anna, feeling okay. Just get exhausted very quickly. Thankfully, only want to eat fruit and veg. Nice. Thank you for more info. Anna, keep it up. Keep the positivity going. I think you're going to be fine. It's not. I know it's never very nice when this stuff happens, but I think you'll be absolutely fine. And I think everything will be okay. So, Kerry, I had a hernia repair at the umbilical. Kerry, what? Oh, you've got the thing above. You've got excess above your belly button. Okay. To be honest with you, Kerry, it's quite common. Well, not that common, but it's not uncommon. Is that helpful? Anyways, it can happen. Having a hernia repair at the umbilicus at the belly button is not uncommon. Should we put it like that? And sometimes you find it during the surgery, incidental finding. You didn't know it was there. Sometimes you know it's there. Sometimes you didn't even know it's there. You find a little hernia, just repair it at the time. I don't think that's going to be causing your excess above the belly button, though. It might be swelling, and if it's quite soon after surgery, then I would wait. Yeah, okay, hypermobility, nice. Yeah, I think I prefer hypermobility, actually. Stuart's in the house. Hi, Stuart. Good to see you here tonight. Olivia, not sure what that emoji is. Blimey. Right, Anna, do you recommend manual lymphatic drainage massage? No, I don't, Anna. And just like anything, I don't think it's bad. I think it's good, in fact. I think it is good. But I don't recommend it, and because I don't really feel that is particularly necessary for my patients. But that doesn't mean I think it's bad. I think so. Is that conflicting myself? Am I conflicting myself there? I just don't feel a need for it. It's like, I don't really want to cure a problem that I haven't got, if that makes sense. So yeah, I don't, Anna, but not because of any particular reason, just because I haven't felt that it's been a big issue. Stuart, I found that after my first surgery, I had 4 drains. Wow. And they were in for 5 days. But Stuart, you've had big surgery, haven't you? On all the other surgery, I've only had a couple of drains. Blimey. And on my last surgery, they were in for literally 2 days and hardly any fluid came out. Yeah, I mean, sometimes, Stuart, what they say is that actually the longer you have the drain in, the drain itself can cause sort of irritation and cause some fluid to come. So sometimes people say, blimey, if I didn't have a drain in, where would all that fluid have gone that's in the drain bottle? But some of the fluid in the drain bottle might be caused by the drain. And certainly I have had a case many years ago now. It was a gynecomastia, a male breast reduction, and I put the drain in. And when you put the drain in, you put a sharp needle with the drain attached to it up into the armpit, and there was bleeding from the drain puncture. And I thought I'd stopped it, and then the chap developed a hematoma that night. So actually, I'm thinking that drain actually caused the hematoma. If I hadn't put the drain in, I wouldn't put that big needle in and cause that bleeding. So that's actually drain causing a hematoma. You know, they say the drains stop, so I don't use them for gynecomastia anymore, and I don't use them, as I say, don't use them that much. But yeah, it's a good point there, Stuart. And sometimes actually the drain, as I say, can irritate things and cause more um, drainage. Self-fulfilling prophecy. Amanda, lovely. Thank you. Thank you, Amanda. Right, preordains. We're going to the preordains now, guys. Preordained question. Where are we at to? We're up to this one. My TT scar is really lumpy. I'm 7 months post-op. Will it stay like this, or is there anything I can do? No and yes. So it won't stay like this. 7 month post-op is really early days. 7 months post-op is, really early. I normally say things start to settle at 3 months. So they don't even start until 3 months. 6, 12, 18 months, maybe even longer for things to properly settle. So lumpy at 7 months, I'm not worried about it. It should be fine. So will it stay like this? Number one, no, it will improve. Is there anything I can do? Yes. Again, stick with your surgeon. Do what your surgeon says in terms of scar management and what have you, because everyone's got their own views on it. But in general terms, what I would do with a lumpy scar, and it often is a bit lumpy after a tummy tuck, then I would get massaging it. Massaging it. Doesn't really matter what you use, moisturizing cream, E45, Nivea, vitamin E, aloe vera. People recommend all sorts of things, but for me, it's more the moisturizer. Massage moisturizer, because it's on your tummy, maybe twice a day, morning and night. Um, if it's really bad, you can think about things like silicone, silicone gel, silicone sheets. If it's sort of red and lumpy and sort of hypertrophic, that's a different sort of scar. Again, you probably want to be talking to your surgeon about that. So if it's red and lumpy, maybe silicone dressings, but whatever it's like, whether it's red or lumpy or not, massage and moisturizing is good. Moisturizer. Stuart in the house. I'm 4 weeks away from my next lot of surgery. God, Stuart, never ending. There'll be nothing left of you. Is there anything I can start taking now to help reduce the swelling afterwards? No. I think staying healthy, positive attitude, and what have you, all these things, they're not going to help the swelling. But I think, don't think there's anything that you can do now that's going to improve the swelling afterwards. No. Just in terms of improving the swelling afterwards, it's more just taking it easy. If I don't know what surgery you're having, but compression if appropriate, if it's chest and abdomen, areas where you can get good compression, that can help. Or if you don't wear the post-op garments, maybe clothes, tight clothes, cycling shorts, things like that. If it's thighs, obviously cycling shorts. Sorry, my brain was thinking about things which I didn't come out with. But yeah, no, not really, Stuart. No, there's nothing you can do 4 weeks before. Assuming you don't smoke. Not after all that surgery, you wouldn't smoke, no. But if you do stop, that's not so much with the swelling, that's more for the wound healing. But yeah, just be positive and I think you will be fine, Stuart. You're a pro. So what we got here? I had a consultation for a TT, tummy tuck, but been told I can't have Mr. No, that's Mr. But it's a muscle repair. As the separation is 3 inches, is it worth having a consultation with someone else? Yes. Yes, it is. I think in general terms, for this sort of stuff, it's all elective surgery, which means it's not emergency surgery. You don't have to go in. The fact that you're even asking a question means that you probably weren't quite comfortable with what your surgeon was telling you. And so in those circumstances, it's always worth getting another opinion. Just go and see someone else. And they might say the same thing, in which case you might want to go back to the first one, or you might go with it. But I think the more consultations you see, the better. The problem is often people charge for consultations, so I understand why there's a limit to how many consultations you can go to. But I definitely think if you don't feel comfortable with what you've been told, it's worth seeing another opinion. And I don't see why a muscle repair can't be performed. You obviously got a wide divarification, but that should be more reason to form a muscle repair, unless they're worried about intra-abdominal contents or something like that. I don't know, but yeah, I would have said second opinions definitely indicated on that one. Good luck with that one. Oh look, we've got swelling all over the place. How can I stop swelling on my tummy tuck scar? Few ladies have a lot of swelling on the tummy tuck scar. This has given a sort of shelf appearance. All are over 4 months post-op. Any advice? So, so Stuart, you can't really do anything to stop swelling 4 weeks before, but in this situation, this is someone saying that there's people getting swelling 4 months after. As I say, it's early days. 3 months things start to settle. It's early days. So the first thing you can do is to not worry about it. Be positive. It's going to be fine. What else can you do about it? You can take it easy. So obviously you don't want to be like taking it easy too much 4 months post-op. You don't want to be sort of lying in bed. So I think it's still good to do things, but certainly heavy lifting activities, you don't really want to be going to the gym doing sit-ups and things like that if it's swelling. I normally say to people, you know, see how your body feels, and if your body's swelling and things, then just take it easy. Maybe it's your body saying you're doing too much. So take it easy, try titrate it in. Don't, sometimes we say, oh, after 6 weeks you can go back to the gym or something like that. That doesn't mean you go back full throttle at the gym after 6 weeks. That means you ease into it and see how you feel. And if it's okay, then carry on. But if it hurts, if it swells, back off. So gently get back into it. So, if it's swelling, and the problem is it's a bit of a vicious circle. Once it swells, it takes longer for it to settle then because you've got all this swelling. Compression also for a tummy tuck is good to wear either the compression garment if you've got one, or those big figure hugging pants you get from M&S, those sort of abdominal contouring pants. Those are good. You might say, well, I've had a tummy tuck, I don't want to go and get those abdominal pants, but they are good for the swelling in the immediate post-operative period. And 4 months is still sort of the immediate post-operative period. Maybe not the immediate post-operative period, but the early, maybe not immediate, early. We'll call it the early post-operative period. It can take 12, well, 6, 12 months, for things to settle. Swelling, numbness, funny feelings, red scar, all sorts of bits and bobs, itching. It can take a long time for everything to settle. It's a big op tummy tuck. So don't worry about swelling. Take it easy. Don't go crazy on the gym, especially if it's swelling. Just give it a chance to settle and then ease into the gym and things like that. And I know it's hard. I know you probably worked hard to get your body right for the tummy tuck, and then then we start saying, oh, crikey, I want to get back to the gym and things. But it can be a false economy if you get back to things too quickly, because you can make it swell. Stuart, top commenter today. I'm 8 months post TT and I'm still swelling. Was told if it could last up to a year. Yeah, absolutely, Stuart. Absolutely true. It could last up to a year. The swelling can take a long, long time. And to be honest with you, I say it to everyone pre-op, but I think they hear it, but it doesn't register because they think, oh yeah, that's the others. I say things start to settle about 3 months, can take 6, 12, 18 months for everything to fully settle. I say that to everybody, but I think you don't realize how long that is until you're in it, until you're post-op. People come back at 6 weeks, say, why is it still so sore? I'm like, 6 weeks. It's early days, really early days. So yeah, things do take a long time. Look at that, Sissy's in. Come on, let's have your swelling. Who can beat Sissy? Sissy's 10 months, and she's still swelling. We got any raise on that? Stuart's got 8 months. We've got some who started off with 4 months. Stuart's trumped the 4 to 8. Sissy's come in with 10 months. It can take a long time for these sorts of things to settle. It is not unusual to have swelling, as Stuart says, up to a year or more, maybe, as long as it's not terrible, as long as it's not like something wrong going on. We're just talking about sort of mild swelling. We're not talking about, but yeah, it's a big op, especially something like tummy tuck. It's a big op. And so you have to be patient. And as I say, it can be a false economy to get back into things too soon, because then you make it swell and then it takes longer for it to settle. So yeah, just try and go through with it. And it's always good that people are coming in now saying they've got swelling as well, to make you realize you're not alone. It's always nice to realize that actually, it's normal, really, to be honest with you. It's the sort of thing you forget when you're 5 years down the line, but at the time it seems like it's never ending. Last question, team. Gonna have to drag this one out. Would a breast cyst stop me from getting a breast uplift? No, absolutely fine. The only thing about so that's the easy answer, no. But the only thing I would say is that if you have got a lump, it's good to get it checked out first. Now, the fact that it's saying breast cyst means suggests you've had it checked out. So, because otherwise, how would you know it's a cyst? Unless it's a cyst in the skin. Anyway, if you got a breast lump, it's good to get it checked out before having a breast uplift or whatever, any sort of breast surgery. Simply because, and a lot of people think, oh, you can check it out when you do the surgery. No, when we do the surgery, we don't really go looking for lumps and cysts and go for treating those things. So you need to really get it addressed beforehand. And the reason for that is that if it is peristaltic anything to worry about, they might do a biopsy, they might remove the cyst, they might cause a scar, they might cause a dent or a lump or some kind of problem. So it's good to get that done first before having your cosmetic breast surgery, because it might alter the type of cosmetic breast surgery you have. So what you don't really want is to have a lift and then they go in and biopsy the cyst and make a scar somewhere and make a dent somewhere, which we could have fixed if they'd made that scar and dent before you had the lift, if that makes sense. So we could have fixed that scar and the dent if you'd had the biopsy first. So I would say get it checked out, make sure it is a cyst, make sure they've done all the surgery, all the investigation they want to do. Oh, hold, here we go, here we go. It's been checked out 2 years ago. There you go. In that case, absolutely fine. If it's been checked out and you're sort of past having any sort of treatments on it or anything like that, then there's absolutely no problem with having a breast lift. The only problem is if it hadn't been checked out. If you wanted to get it looked at and examined, do that before the breast. But it sounds like you've done that already, which is absolutely fine. Crack on. No problem with having a lift if you've got a breast cyst. And look at that to end on. It may even have gone now. There you go. And it's disappeared since the question was asked to now. Look at that. Brilliant. Curative broadcast. That's what we like. Treating people across the airwaves. That is excellent. Whoa. Shaky start, but some good commenting coming in. Strong comments. So that was very, very much appreciated. Thank you all for your comments, your experience. Very interesting to hear experience if you had swelling and if you had hypermobility and things. That really helpful when people come in and comment about that sort of stuff, to have a real person to give their experience on that. So thank you for that. I will be back next Tuesday, 7 o'clock, relying on questions. I'm looking at you, relying on some questions to come out. So get your questions in. Facebook me or email or Twitter or Instagram. On all social platforms. Khan, you still here? Thank you, Khan. Not thank me. Thank you. Olivia's here, and I believe that's a clap or a wave, but whatever it is, and your picture's a wave as well. So nice to see you, Olivia. So thank you all. I'm going to check myself out of here, and I'm going to suggest that we meet again Tuesday night, 7 o'clock. I'm looking forward to it already. See you there. Have a great evening. And I don't need to tell you the final episode of what's it? There's two, isn't there? Confession and what's the other one? Capture? Is it the Capture? Final episode of Captures on tonight. I'm looking forward to it, to be honest. Just get it done now. Get it over with, What, Olivia? I'll listen when I finish work at 10. Listen what? To this? You've been here, Olivia. You've been here throughout, haven't you? Stuart, thank you. Good to have you on board. So yeah, better get my hot chocolate on and secure my seat on the sofa, and I'm gonna go and watch some telly now. So have a good evening and see you next week, same time. Well, hopefully proper time next week.